Hey, this is another one of those, we predicted it, but then when you read about it, it's like even worse than what you imagined. We have now learned that employees at Donald Trump's Chicago Trump Tower were all vaccinated early, well before they were eligible. And interestingly, this may not be about Trump specifically, but it probably is. We're not completely sure yet, and you'll understand why in a moment. The vaccination at this Trump building was arranged by a hospital COO that lives in the building, and that's 37-year-old Anosh Ahmed. 72 employees of Trump's hotel and condo tower received vaccines on March 10 and 11, but city guidelines say that hotel employees aren't actually eligible for vaccination until March 29th, so they were almost 3 weeks early. The mayor, Lori Lightfoot, said, quote, "We have a finite amount of vaccine in the city. We've been really, really careful to make sure we're using it in a way that prioritizes the most vulnerable people who are most at risk and most at risk of spreading it," adding, "We can't have something like this happen again." Now, the hospital itself is located in a mostly black neighborhood 9 miles from Trump Tower. It claims that its mission is to provide vaccines to the, quote, minority communities hardest hit by the coronavirus pandemic. But what happened is vaccines were taken from there and brought 9 miles to Trump Tower. It's sort of the epitome of the worst of the worst. Now, is it just coincidence that it's Trump Tower? What I mean by that is, okay, the COO, Anosh Ahmed, lives in the tower, and maybe it was just what he would have done regardless of where he lived, and it has nothing whatsoever to do with the Trump family, except that Anosh Ahmed bragged that Eric Trump was one of the individuals vaccinated. And there's even a picture of them together, although it's not immediately clear if this picture is from vaccination day that we are currently showing the audience. Ahmed also sent to others a picture of himself posing with Eric Trump. On March 13th, Eric Trump tweeted 2 pictures of the Chicago Tower and the city skyline, which confirms that he was in Chicago right around the days when this vaccination at Trump Tower was supposedly taking place. So it's not looking particularly good. The hospital initially said, "Oh, we were confused. We thought that hotel employees were already eligible, but then we found out that they weren't really eligible." That seems insanely difficult to believe. If you're going to drive the vaccines from the hospital to Trump Tower and you don't even know whether you're not even going to really check whether the hospital workers are eligible. They said they thought that the the hotel workers rather were eligible. So that imploded. So their newest statement is that, well, listen, even if they weren't yet eligible, a lot of those 72 vaccinated Trump employees were black and brown, which is just sort of like, now you're going to pull the race card yourselves as the story crumbles. So it all stinks. This is just one story. And there are hundreds or thousands of stories just like it. Most don't involve Trump. By the way, read up on what's happening in Argentina, where I was born, with vaccinations. Anything you can imagine is happening there. Functionaries of the government are being caught with literally thousands of vaccine doses in the trunks of their cars. When they're asked, what are you doing with that? They're saying, "Oh, I was transporting them." You're transporting vaccines? That doesn't really make any sense. The governor of the province of Buenos Aires. So Buenos Aires, it's almost like New York City and state. You have Buenos Aires, the city, and you have Buenos Aires, the province. The governor of the province of Buenos Aires has been involved in under the table vaccinations for prominent people. There's like prominent Argentinian authors and intellectuals who reported they were offered vaccines even though they don't qualify. They live in the province. I mean, this stuff is rampant globally. It was only a matter of time until one of these vaccination scandals touched the Trump family. And this is the first one we know of taking place in Chicago. So we'll see what else we can learn about it. 1 week from today, Friday, March 26th, very special day, we start spring break for the David Pakman Show. No, but in all seriousness, we're doing a 1-day membership special. February, the first part of March, it's not been great from the standpoint of memberships. A lot of people writing saying, "David, I've got to cancel. I just can't afford it. I'm cutting this. I'm cutting HBO. I'm cutting cable." And I get it. So we are doing a huge one-day membership special Friday, March 26th. If you want to hear about it on the day of with instructions about how to sign up, get on my newsletter at davidpakman.com. And Friday morning, you'll get an email telling you exactly how to sign up. We'll take a quick break. We will hear from you. I want to hear what is on your mind. We will take some calls via Discord momentarily, and much more coming up today. If you are anything like me, you probably aren't thrilled with the idea of going into a doctor's office right now. And thankfully, there's a practical and affordable way to take control of your health and get personalized care from the comfort of your home. It's a service called SteadyMD. They're one of our sponsors. You take a quiz, you get matched with a licensed primary care physician who understands your health needs. You have a 1-hour video call with your new doctor. You establish a meaningful relationship with them. And after that, your doctor is available to you anytime by text, phone, or video chat. This is not a random doctor on call. Each doctor at SteadyMD has a limited number of patients, so they actually have time to listen to you. You get the personal attention that you deserve. They can do almost everything an in-person doctor can do: perform medical evaluations, talk to you about health concerns, send prescriptions to your home or local pharmacy, and anything they can't do online, they'll quickly set you up with an in-person provider to do, things like blood tests, as an example. You don't need insurance. It's only $99 a month with no other fees or copays. There are so many practical advantages to using SteadyMD for primary care, and it's also so much more affordable. Go to steadymd.com/Pakman to take the free quiz, see which doctor is right for you. I took their quiz. They matched me with a doctor who specializes in my particular health needs and situation. The doctor they gave me is a really perfect fit for me and my medical needs. There's no risk, no commitment to get started. Just click the link right underneath this video.